Welcome and thank you for joining us for our second half hour of The Factor Uncensored tonight. Oprah Winfrey has admitted to using weight loss medications. She told people criticism of her weight truly hurt her over the last few decades. It wasn't until she did a panel discussing weight for her website that she decided to stop blaming herself. Medications, regular hikes, and lifestyle changes helped slim the star down to 160 pounds, just 7 pounds short of her goal. Joining us to talk about it, Dr. Donnie Shaw Lee from the Archpoint Pain Institute. Your thoughts on Oprah using a weight loss management drug to get the weight down?
Yeah, Isaiah. So we know Oprah struggled with weight loss and her weight for decades. She's talked about it. She's been, talked about from other folks as well. And so I think that this was important, a big step for her. And to admit to that was also even a bigger step for her. And so, yes, she has come out and said that, and she hasn't listed the medication. However, there are a whole slew of different medications out there for the treatment of weight loss, and we don't know which one she took specifically. However, what we do know that she took a holistic approach to this, Isaiah, which means that she did continue to exercise. She drank a gallon of water a day. Her last meal was around 3-4 o'clock in the evening, and so she was doing a lot of other things as well beyond just taking a pill or a medication for weight loss.
And for those who are wondering about this medication, and there's several out there on the market, how does it work exactly?
Right. So lots of them have different mechanisms by which they act. Some of them will suppress your appetite in your brain. Some of them work in the actual gut and stomach. And so it depends on which medication is right for you. Therefore, again, as we've said before, Isaiah, it's so important to talk to your provider, to your physician about this, because depending on what outcome you want, depending on how fast you want it, what sort of things you're looking for, and what other medical conditions you have, you may not qualify for and benefit from some of these different medications.
For those who are wondering really quick, what are some of the pre-existing medical conditions that would preclude you from getting this medicine from your doctor?
Yeah, it's not that it would preclude you, but we need to know about it, and the treatment is different. So, for example, if you have, diabetes, right? So diabetes are specific medications that are actually help diabetes, and it will also help with weight loss. And so that's that. Or if you have like a history of pancreatitis or liver disease or kidney problems, we have to alter the medications accordingly or provide different ones because of some of the other medical conditions that you may have.
Now, many people will be interested in this. Many people will ask their doctor for this medication. I remember at some point during the popularity of these weight loss drugs, we were hearing there was a shortage out there. Is there still a shortage for these drugs, or are they available readily now for those who want to get on it?
Yeah, so there is still a shortage, Isaiah, depending on which medication. I know that they've right now or recently Ozempic has been talked about a lot, and that's one medication that's kind of difficult to obtain. However, there are other options. There are medications, there's injectables, and there's different forms, and that's why it's so important to talk to your doctor about this to determine what's the right option for you. She's been taking an actual oral medication, is our understanding, which is a per day medication versus an injection, which you could do per week or per month, etc. So again, tailoring it and discussing this. And again, I have to say this, Isaiah, I strongly discourage obtaining these medications from the streets or from other folks, or your loved one that says, hey, listen, I got this great weight loss bottle here, take it yourself and see for yourself. We don't know what it is, what may be in it, where it's obtained from. Some of these medications need to be refrigerated. So it's so important to talk to your doctor about this before you just start taking anything for it.
And the final question, Dr. Ali, for those who are wondering, how much weight can you actually lose on these medications, and how fast will you start seeing the results?
Sure, Isaiah. Yeah, so it depends on which medication you start, depending on after your discussion with your physician. Some can be as little as 10 pounds, and some can be as much as 50 to 60 pounds, right? It just varies depending on, how obese you may be, what other medical comorbidities you have, and also the fact that how much of an approach, you can't just take a pill and expect to lose all your weight, right? It's that holistic, it's the doing all the other stuff as well, exercising regularly, drinking lots of water, talking, not having a late supper, or, taking small meals. All of those things that kind of go into it, I think we forget that this is not just a one pill that you take and you start losing weight.
All right, Dr. Donnie Shaw Lee, Arch Point Pain Institute. We appreciate your time and always good to have you here on The Factor Uncensored. I'm sure a lot of people will be talking about this revelation or what Oprah has decided to share with the public, and I'm sure a lot of people will get in line for this drug. So prepare. And really quick, before we go, can you go to, say, any of your medical doctors for this, or does it have to be a weight loss specialist, a doctor that specializes in that?
You want to start with your primary care doctor, Isaiah, and that person knows your medical history. They know what other complications or side effects that you've had to other medications. So start with your primary care doctor. If you do not have one, then yes, you can ask for a weight loss physician. Your insurance, you can call your insurance. You can Google it. There's a lot of options out there, but start with your primary care doctor if you can.